Hello, Senator Schumer. Uh, it was very nice of you to come to the phone at this hour. And I just spoke to Anthony Weiner, and he sounded interested. When I ran into you in the hall of the Hart building, I didn't run into you, as a matter of fact. I approached you, and you ran away from me. Uh, I'll bet you were a pretty good track man in your day. But anyway, I spoke to Weiner, and he sounded interested in the public option that I've proposed, and I think you ought to take a look at it. I don't want to belabor you with details at this hour, but you can see it on the website www.the.public.option.com. Follow the links. It'll take you to another website about primary care centers, and it outlines my thinking and proposition about this problem. As I said to Weiner, the senators are fussing with the economics of healthcare without understanding the practice of medicine. The practice of medicine starts with robust primary care, where a doctor in his office not only does what the family practitioner today is supposed to do, but the office physician should also do procedures that were listed by the healthcare center in Colorado. Here, primary care doctors are accused by their patients of doing nothing more than writing prescriptions and referring them. So they end up in a wilderness of specialists. They don't know what the hell's going on. And then when they try to get back to their primary care doctor, there's a 2-week or 3-week wait for an office appointment. And this is a ridiculous way to practice medicine, I can assure you. And it's true, by and large. I've been to doctors, and you really don't get the time of day. I don't remember I really don't recall having a proper physical examination, either in a doctor's office or when I was sick in the hospital at any time. In my day, a patient came into the emergency room, we probed every orifice. I mean, we had gloves, we had stethoscopes, we had otoscopes, and we had ophthalmoscope, and we looked in the eye and looked in the ears and poked around and took a complete history. This isn't done today. My friend John Rabel, he's a doctor here, he's really pissed. He says the medical profession has to get back to basics. Back to basics starts with a robust primary care situation. This can be found in the primary care centers of America. Properly deployed, all Americans would be assured, not insured, primary care. It would be available. So anyway, read those websites. Take 10 minutes out of your busy day. Talk to Weiner about it, and maybe you guys could get something going. Oh, I asked Anthony Weiner whether he was going to run for the Senate, and he lied. He said never. Sure, he's not going to come up against 2 Democrats, or at least admit it at 7 o'clock in the morning. But anyway, listen, thanks for giving me the time, and take another few minutes, look at the websites, and have happy holidays, okay? I'll talk to you again next week.